Thanks, Ruth. And it's lovely to be here, down here in Middlesbrough, in the deep south of the northeast of England. And I think the next few minutes I'm going to just talk through the kind of approach that we're trying to take in the northeast. And I think today is about refreshing our ambition. And I think we have got that ambition in terms of our system in relation to helping people to quit smoking and to maximise that as much as possible. Particularly now, we have seen our NHS colleagues really step up and come to the fore in this area of work. I'm a little bit of a fraud. I think Clive said that a little bit as Chief Exec. I don't think he was quite too much of a fraud. But as myself and Alice, as the leads for tobacco control, as Directors of Public Health across the North East, we can only do that with the work of many of you in the room. We've got a lot of our tobacco commissioners here. But Andy Graham, who's our consultant lead in this work from Gateshead, wasn't able to be here today. And he's very ably supported by our colleagues from Office of Health Improvement and Disparities, David Gardner and Glyn Smith. And I think that plays to that work around solidarity and collaborative and working together and not competing with each other, even though we have the ambition to improve. And I guess what we've realised is that, you know, obviously stop smoking and supporting people to quit is a really key strand of our comprehensive tobacco control approach. And, you know, Ailsa had the flower up before, the 8 strands. And sometimes this kind of strand can possibly be left behind a little bit. So this work that we're going to do collectively across the North East is to really challenge ourselves and put that back at the centre of our approach to ensuring that smokers can have every opportunity to quit. And we've heard some of that both from Robert and from Sharon in terms of people need more opportunities to be able to quit, and they need the offer to be the best offer, as well as revisiting the evidence base as well. So we have seen, and obviously what we've seen in the NHS is that the work in relation to tobacco is talked about in terms of a clinical service and tobacco dependency. And I guess what we want to really know by talking to our local residents is actually, is that right for people in all circumstances? You know, and actually do we need a mix in relation to that? And regardless of what we are doing, and we've got some fantastic services across the North East and our system across the North East. When I show the next slide, our numbers of people coming through our frontline services are reducing. So we need to be thinking about what we are doing. And certainly from listening to Sharon and some of the pilots that we have underway, you know, are we reaching people who we really need to give multiple attempts to quit? Now, so this has been an ongoing piece of work, and now, as I say, our Tobacco Commissioners Network have kind of debated and scratched their head long and hard along this to come up with a dedicated piece of work that we're going to do. And some of that rationale is because we are seeing the quit rates start to decline. So year on year, in spite of, as I say, you know, some excellent services, and now us thinking much more as a system. In years gone by, there would only be what was previously NHS and then the local authority stop smoking service, and they do vary across the North East. We've seen that in Sir Liam's slides this morning. We also now see that people go through, you know, and do get treated in the NHS. So how do we ensure that within that we have our quit rates as high as possible, and we see that that is an increasing rather than a declining trend? We have seen the landscape change over time as the behaviour and the needs of smokers have also changed. And obviously we've seen, and Ruth's just really eloquently described the offer that is now in place for many parts of our NHS, and I know we'll hear this afternoon for some of our maternity services too. So what is on offer is different, and people need that in as many places as possible. And we've got a range of new technologies. Obviously, we've heard from Anne in terms of vaping. So the landscape is different. We know that having a really clear evidence-based stop smoking offer can form a really key part of our overall tobacco control programme. But we still feel there's a bit of disconnect there between what is happening, you know, in some of our local services, some of our NHS, and this is an opportunity to really think about doing that much more collectively and really looking at the equity across and within our provision. So the Tobacco Commissioners Network posed two questions of themselves, which is always good. So, do we have the resource that funds local authority stop smoking services, which results in an equitable, efficient, and effective provision? And I think, in all honesty, I think in the moment we would have to say that we don't. So the piece of work that we'll be doing is going to look at that and really digging beneath the surface and come out with recommendations to change some of that, where we need to be much more ambitious. What can we then do differently? So looking at that health equity approach, really thinking about how we narrow health inequalities within the smoking population. And again, when we've heard about the smoking population, what about some of those groups that we absolutely need to reach out to? Exactly as Sharon said, they are not hard to reach. We have to try much, much harder to reach out to them through some of our existing provision, through our drug and alcohol service provision, through some of our work with people with severe mental illness, and all of the time listening and learning from people who have either attempted to quit smoking, or who want to quit, and thinking about that offer that needs to be in place. And really thinking then about different approaches and the measures of success. So what does that success look like across the North East? And again, funded through the long-term plan, we have pilots for people with severe mental illness. And we're absolutely seeing that people are quitting smoking and switching to vaping the first time they've ever tried to give up smoking. We're also seeing that within some of our really, complex drug and alcohol. And I thought it was really interesting what Sharon was saying, that actually sometimes smoking is the last thing. It's kind of almost put to one side. There are many, many other important issues, be it housing, be it employment, be it existing treatment. Smoking needs to be right at the core of that. So we need to ensure that our stop smoking system can be much more adaptable to that. And we need to create a system approach based on that system stakeholder collaboration. We've got, and it's fantastic because we've got lots of new kids on the block in terms of stop smoking service within, for example, our NHS. We have our existing stop smoking services through local authority, but actually are we working in a collaborative way from a person's point of view? If they go through that service, through that system, are they going to see something that is consistent? And we really need to kind of build that quit-friendly environment so that it promotes as many quit attempts as possible and as often as required. I think traditionally we thought, right, quit attempt, 12 weeks, great, stop, tick the box. Actually, it needs to be again and again and again. And it has, I think, been inspirational this morning as we tip into the afternoon, and I'll be watching time. And I was really interested in what Robert said about we have done it before, so we can do it. And I think we have shown, and this is some findings from our local health equity audit of our existing local authority stop smoking service, which shows that actually the access rate for people in the most deprived areas is actually the highest. So we can do the right thing. And as long as we are monitoring, and we've done this 3 times now, it's kind of systematic, our public intelligence team are right, it's time to go again, we need to do it again. And that's where we need to be really systematic in terms of our attempts to reach to people who are in areas of deprivation, who may have more complex needs. We know we need to really think about that quit rate. That comes back to, are we offering the right tools and techniques to help people to quit and to help people as many times to quit. And that does feel like that shift and very aligned to what Ruth has said. And I put a little heart around my person in the middle, and we'll hear the difference that it makes when it's from both Sue and from Kathy this afternoon. And we've got to, in our minds, think about those people every time, because they are a person and we can't just hand them off from different parts of our system. We need to be collective in our approach. And I think the positive thing is we are wanting to do that. And this is the commitment through our work in the North East. So our Tobacco Commissioners Network have developed our approach into a North East position statement, because I think we're quite proud of what we want to do, as well as really, really challenging ourselves. So we've got that refresh statement on helping smokers to quit. It does provide a rallying point around those innovative approaches. We do want to think differently, but I'm really mindful of actually let's not forget, and that's what's been so good this morning, let's revisit that evidence base. Are we focused on the evidence base, and then where next to go? And it will allow us consideration of other measures in relation to targeting people who are most in need and who will need a different kind of approach. We recognise, and again, going back to Salim's slides, we have got differences across the North East. Not one of the directors of public health is not committed to this agenda, not wanting to do the best and have the best stop smoking services and our wider tobacco control. But we recognise that variation, and we really want to learn and understand through this work what we need to be different. And then the really good thing back to myself and to Alice is that the Tobacco Commissioners Network and David and Glenn colleagues will go away and do all of this magic work, and then they'll bring it back to our network through our joint network with the NHS and with Neil, and we'll make hopefully some really specific recommendations so that our smokers, wherever they are in the system, have a really fair chance and fair access to our services, and that once again we can say our services are the best services in the country. So on that note, I will hand back to Peter. Thank you.